Some people believe that Lyme disease is overdiagnosed and overtreated. And by overdiagnosed, I mean people who do not have Lyme disease are diagnosed with Lyme disease, often for no good reason that I can identify. And overtreatment would be antibiotic therapy that's in excess of necessity. Why should they be overdiagnosed? Why is it overdiagnosed? People are suffering. People are not feeling well. And if they go to a certain kind of doctor who believes that Lyme disease is every place and everything, then they'll be diagnosed with Lyme disease. And there are plenty of those doctors around. On the other hand, if they go to somebody who's a little bit more rigorous and perhaps, I mean, the other side would say stubborn and difficult, but somebody who's more rigorous, the diagnosis of Lyme disease may not be made. Perhaps there's something else going on. And in my experience, we've seen lots of patients who were diagnosed with Lyme disease who did not have Lyme disease. Maybe they had it once, but what they have now is not Lyme disease. And there was a recent study published by Leonard Sigal in Arthritis and Rheumatism where documentation of patients who once had Lyme disease who now have rheumatoid arthritis, some patients who had psoriatic arthritis, some who had spondyloarthritis, ankylosing spondylitis, not Lyme disease. And I published many years ago in the American Journal of Medicine about all the patients we had seen in our Lyme disease referral practice where many, many of those people did not have Lyme disease. So it's really sometimes the a priori bias of the clinician. And as for overtreatment, if you subscribe to the academically approved, I shouldn't say approved, the academically accepted guidelines, then you treat in a certain way with certain antibiotics for a certain duration for different manifestations. If the person does not get better, you have three options. One option is retreat. There's no proof that that's of any value. The second option is look for another diagnosis. Maybe something else is going on. And I must tell you that we've seen a lot of patients who have quote-unquote chronic fatigue as a manifestation of Lyme disease, who in fact have fibromyalgia, a musculoskeletal pain syndrome predicated on poor sleep and muscle deconditioning. It's very common. We've seen a lot of it following Lyme disease. Alan Steer had the same experience up in Boston. So the first is retreat. The second is look for another diagnosis. And the third is just wait, because not infrequently the symptoms of Lyme disease will dissipate over time as long as you can deal with the anxiety of the patient, because some patients will show up, they're convinced they have Borrelia burgdorferi, corkscrewing its way into every organ system they own, and they're scared. And fear is a terrible magnifier of symptoms. So we need to be aware of the anxiety, aware of the fear that the patient has, and then address it appropriately and not dismiss it. You know, you can't say, oh, it's all in your head. That's an arrogant and stupid approach that doesn't serve anybody's purpose.